Good morning. This is Mr. DIBO. I want us to look at the pre-operative care headings you consider when writing an emergency pre-op. So in part 1, we are going to discuss a few, and in part 2, we are going to complete the headings. So what are some of the headings you need to consider? Number 1, you need to consider aims. So what are some of the aims you need to consider now under aims? Some of the aims you need to consider are aims such as to prevent shock, to treat shock if present, to reduce pain, to allay anxiety, and to save life. Remember, it's an emergency. Then from aims, you need to move on and look at primary assessment and resuscitation. Now, under primary assessment and resuscitation, here you need to introduce to your examiner the type of approach you are going to use. So you are going to say, I will quickly assess my patient and resuscitate using the ABCD approach. Okay. After that, you are going to now write few things under primary assessment and resuscitation. The first thing you are going to consider under primary assessment and resuscitation, it's maintenance of airway. Now, under maintenance of airway, here you are going to tell your examiner that I will quickly assess for signs of airway obstructions. Okay, signs of airway obstructions. Now, what are some of the signs of airway obstruction? Some of the signs of airway obstruction are that the patient will have evidence of secretions, okay, in the mouth, and apart from that, there will be some dentures. So you need to observe the signs of airway obstruction. Now, after observing for signs of airway obstruction, you need to take certain resuscitative measures to overcome what you've assessed. Some of the measures we are going to look or to consider under this are that you are going to suction if there are secretions. Now, in case the patient is unconscious, you are going to use a tongue depressor to avoid the tongue from falling back, therefore keeping the airway patent. Okay, then the other things you consider under this one is that if you cannot use a tongue depressor, you can even use the sterile oropharyngeal airways to prevent the airway blockage by also preventing the falling back of the tongue. Then even the positioning of the patient. Here you are going to head tilt and chin lift just to simply keep the airway open or patent. Then the other thing you are going to consider under primary assessment and resuscitation, it's maintenance of breathing patterns. So under maintenance of breathing patterns, here you are going to quickly assess for the general signs of respiratory distress, okay, such as sweating, use of axillary muscles. So in case of that, here you are going to quickly administer oxygen to maintain the normal breathing patterns. Very, very important. Then you are also going to consider maintaining of the circulation. Now, your main goal of maintenance of circulation is to prevent hypovolemic shock. Okay, so here you are going to say, I will quickly assess for any signs of circulatory failure, such as signs of hypovolemic shock. Okay. Now, signs of hypovolemic shock include 0 or low BP. So assess for that. Now, in case of such signs, what are you going to do? You are going to give blood to restore normal blood volume. You are going to administer fluids, therefore restoring the electrolytes lost. Then from there, you are going to look at drugs. Now, under drugs here, you can give prophylactic drugs or even certain drugs which will alleviate pain. Remember, pain can also bring about shock. Then we move. You are going to look at other headings such as secondary assessment. Now, under secondary assessment, the first thing you need to consider is history taking. Okay, now being no time here, you are only going to take history which is relevant for the patient's present condition and that which is going to be useful for resuscitation and approach for surgery. From there, you are going also to consider physical examination. Quickly take a physical body nursing assessment for specific body system relating to the problems or other current concerns. So this may involve assessing one or two body systems physically. Then now you come to the actual investigations. Now on actual investigations, there are two types of investigations you should do clearly state. The first one are imaging investigations. Under imaging investigation here, these are investigations which will give you a clear picture of what is happening inside. Okay, such investigations include X-ray, CT scan, or ultrasound. Then the other investigation you are going to consider are hematological investigations. Investigation pertaining or concerning blood or lab. Now, such investigations include blood for HB levels or taking blood for grouping and cross-match in case of blood transfusion. Then you move on to the next heading, which is environment. Now, under environment, you simply want to tell your examiner or to show your examiner the type of approach you are going to use in terms of the environment. Okay, so show the examiner what should be in the environment in which you are going to nurse the patient from. For example, you are going to nurse the patient in a room which is cleaned already to prevent infection. Nurse the patient in a room or environment which has already oxygen machine for oxygen therapy. Okay, nurse the patient near the sister's bay for easy observation. So there are a lot of points you need to consider under environment. Then the other heading is positions. Okay, so you are going to nurse in the patient in the position which the condition allows. Okay, so from the position you are also going to look at observation. So there are a lot of things you are going to observe for. You are going to observe vital signs. Okay, you are going to observe the facial expression for pain, and if necessary you are going to even give painkillers. You are going to observe for signs of anemia to prevent shock. You are going to observe for pallor, okay, throughout breathings. Then from there, having written your observations, you are going to look at pain management. So pain management here, you are going to provide other techniques which are pharmacological and non-pharmacological in terms of managing pain. For example, diversion therapy, administration of certain drug or painkillers, okay, as you continue stabilizing the patient. Then from there, you are going to look at psychological care. Now that the patient is stable, you have alleviated pain and the patient is no more in pain, or you've reduced pain. Consider psychological care. Here now you want to prepare the patient mentally for the operation. Remember the preparedness of the patient. The preparedness of a patient for operation is very important for the successiveness of surgery. Okay, so here you involve the family members, and if the patient is still unconscious, give psychological care to the relatives or to bedsiders. Okay, then from there, you are going now to consider giving a consent form. So the patient should sign a consent form. Okay, making sure that after they have signed this consent form, it legalizes, it protects you and the entire team. Very, very important. If the patient cannot sign, if they are unconscious, there is no relative, the physician should take up the position of signing. Then, from there, next time we are going to meet, we are going to continue with physical preparation. For now, this is where we are going to end under part 1. So subscribe for more videos and more insight on surgery and other relating nursing condition. So this has been Mr. Dibo taking you through certain headings you need to consider when writing your emergency pre-op. Very, very important if you want to pass your exams. So it's goodbye from here and enjoy the rest of the day.